together on this webinar until 4 o'clock. And for our assembled guests and friends, thank you so much for joining us this afternoon for Respond, Rebuild, Reimagine, Working Toward Equity After COVID-19. This is Cheryl Dorsey. I'm president of Echoing Green. We've got a terrific group of panelists today to kick off a conversation that honestly I hope will continue beyond this call. I think one of the reasons Echoing Green wanted to reach out to our broad community of friends and supporters and like-minded journeymen, we're all living through this unprecedented moment, and the need to not only communicate but over-communicate in this moment seemed especially critical. And one of the things that Echoing Green does best is to build and hold community. And we thought no better way than to reach out to some of our nearest and dearest and to hear from one another about what we're seeing, what we're thinking about, and what we're learning in this moment. And I think we're really privileged and honored to have two of our board members who bring such a unique and important perspective to this unprecedented moment. Before we jump into my introductions of both of our speakers today, let me just tell you a little bit about what Echoing Green has been experiencing over the last few months. Like all of you, we've just been buffeted about by this global disruption. You know, I was looking at the statistics today. We're now up to about 3.5 million cases worldwide. 1.2 million of those cases are here in the US. We've now got a worldwide death toll in excess of about 210,000, with about 69,000 deaths here in the United States. We're now at the point where every day we're losing about 2,000 Americans. That's about one death per 44 seconds. So it is visceral, it is painful, it is traumatic, and the level of disruption that is being felt across society, I think we're only beginning to absorb it. That as well is felt by many of the social entrepreneurs within our community who are on the front lines of this pandemic. These folks were already working on many of the structural inequities related to income disparity, educational inequities, health inequities, but it's the fight that many of the fellows in the Echoing Green community have dedicated their professional lives to, this idea of democratizing access to critical resources. And this has only been exacerbated and inflamed in this very tough moment. There are about 900 Echoing Green fellows and alums working around the world. A significant proportion, including Dr. Raj Panjabi, whom you'll hear from shortly, are on the front lines thinking through some of the healthcare implications of this moment. Folks like Raj, many of you know, founder of Last Mile Health, has such a unique expertise and experience. He was critical in helping to halt the Ebola outbreak in West Africa about 5 years ago. He's now working very closely with a cadre of organizations across this country, the United States, to address the spread of COVID-19 and sharing some of the lessons learned he and other glean from working in a global context. In addition to many of our fellows working on the front lines of healthcare solutions and healthcare responses, we've got about 250 or so of our fellows who are really working on issues around wealth disparities, income disparities that really play out in a moment like COVID-19. I was looking at some statistics recently. In Chicago, for example, 30% of the population there are African American. They represent 46% of the cases of COVID-19 and 60% of the deaths. That's sort of a clear articulation numerically about what these structural inequities look like for impacted communities. You've got fellows in our community like Purvi Shah, the founder of Movement Law Lab. She's based in Baltimore, but she's working with a network of lawyers, not only in this country, but even globally, to begin to organize lawyers around the world to support those most deeply impacted by the pandemic. I think it's a terrific example of some of these social innovators who are really looking at the social safety net fracturing and fragmenting, whether it relates to housing or healthcare or other things. All of these opportunities, all of these social innovators are in play around the world doing this work. I'm sure we'll come back to it later in the conversation, but Echoing Green, like all of us, is trying to figure out in real time, how can we step up and mobilize our community in this unprecedented moment. We've recently launched something called the Fund to Mobilize Against COVID-19, which really puts the work of our fellows at the center. Everything from providing immediate and emergency grants to our fellows for urgent needs. You know, it was interesting. Civil society is so critical, not only for democratic practice and raising up the needs of people, but also for the work that is done across society. If you look at some of the data out there today, done by groups like Independent Sector and Sea Change, sort of the level of vulnerability and fragility of our nonprofit sector is really breathtaking. There's some analysis that shows that less than 50% of nonprofits have 1 month of operating reserves on hand and less than 6 months of cash to keep them running. There's even data showing that up to 8% of nonprofits in the US are technically insolvent. These are the folks, the frontline organizations that we're asking to step up even more in a moment like COVID, and they're not being provided with the resources and support to make that happen. This, despite the fact that we hear a lot on the news about the federal government response on helping big industries in this moment, airlines, hotels. But I think many of us forget that the nonprofit industry actually employs more people than many of these industries. There are about 1.6 million organizations, nonprofit organizations, staffed by about 12 million folks, not even counting the close to 80 million volunteers. This is a robust sector that is needed now more than ever, that is hurting in this moment as they're trying to do more with less. So recognizing that not only is the work of the Echoing Green community important, but the broader nonprofit sector as a key response mechanism to how we will move through this moment. So in order to flesh out these and other issues, I'm just so honored and excited to tee up two Echoing Green board members who are coming at this work from different vantage points. Let me quickly introduce them and then turn it over and help them frame the lane of the conversation that they are interested in tackling with this group today. I'm looking here on my screen at Dr. Raj Panjabi, who is an Echoing Green alum and also a wonderful Echoing Green board member. I think most of you know Raj as the co-founder and CEO of Last Mile Health, which partners with governments to design, scale, and advocate for national networks of community health professionals. Raj is a real global leader in this space. I'm sure many of you saw one of his post on Medium back on March the 19th, when he was already calling for essentially a Marshall Plan of this country, where we took unemployed US workers and hiring them to fight coronavirus. That's the kind of visionary thinking that has led Raj to be named one of Time Magazine's most influential people in the world. He was a 2017 TED Prize winner, and in 2018 he was named as a recipient of the TED Audacious Project, along with Living Goods, to help scale digitally empowering community health workers. Then we'll turn to Echoing Green board member and Echoing Green board co-chair, Carter McClelland. And I was thinking, you know, in introducing Carter, that the dean of Stanford Business School, Dean Jonathan Levitt, said it best when he presented Carter in 2019 with a Stanford Business School Excellence in Leadership Award, when he noted that Carter has made significant contributions, not just to the corporate world, but also to the community. Carter's had a long-standing, glittering business career. He was CAO of Morgan Stanley, where he began his investment banking career. He went on to chair Bank of America's Securities Division, where he oversaw the bank's global corporate and investment banking relationships. Most recently, he launched Union Square Advisors, which is an investment bank focused on the technology sector, and he currently serves as the chair of Union Square Advisors. In addition, he serves as co-chair not only of our board, but he is also an advisory board member of Stanford PACS, which is the Philanthropy and Civil Society initiative out of Stanford. We've got a really phenomenal speaker lineup, and I'm really anxious and interested to hear more of both of them. So I would love to first turn it over to you know what, we'll start with you, Carter, and then I'll turn it over to Raj. I would love for each of you to speak to the assembled group for a few moments, and then we'll open it up to a broader conversation. So over to you, Carter.
Sure, thanks. Well, first of all, thank you for that introduction, Cheryl, and thank all of you for attending today. Echoing Green is near and dear to my heart. I met Cheryl in 2014 at an event in San Francisco with a couple of her fellows, and immediately took to heart the mission that Echoing Green was pursuing. And quite frankly, as Cheryl alluded to, I spent a lot of time in the technology sector, a lot of time with venture capitalists, and the parallels to what venture capitalists do in terms of identifying talented individuals with a big vision and a lot of drive is very similar to Echoing Green. They're great talent spotters. They've not only funded and identified talent, they get close to 3,000 applications a year for 20 to 30 fellows a year, and have built a community, as Cheryl said, of almost 1,000 fellows. So the work is invaluable. I think this conversation, and thank you all for attending, is great for us to make sure you understand that we have virtually 1,000 people in the field with powerful organizations that are essential to getting the world through what we're experiencing now with COVID-19. You read a lot in the press, and I come from the world of business about how this is going to return to whatever the new normal is quickly. I don't agree with that. I actually think the reluctance, the devastation is huge, 30 million people being unemployed, and the road back to some semblance of normalcy, I think, is going to be measured in many quarters, not a quarter or two. I think it's therefore even more important to the work that we and others do at Echoing Green to make sure these organizations, which really are part of the safety net of getting the world back on its feet, are strong and resilient. And that was really the genesis behind Cheryl and the rest of the management team and board's underpinning of wanting to do this fund for COVID-19. So I'm enthusiastic about the work, and I'm looking forward to the conversation. So Raj, let me turn it over to you.
Well, thank you. And I just want to thank the Echoing Green, both staff members and leaders like Cheryl, but also all of you in the community that's been around the ideas that Echoing Green stood for many years, ideas that I think are, only more important right now. We, speaking as a physician who's had the privilege of working here in the United States as well as in Africa where I grew up, I can tell you, and you can see this in the news as well, pandemics, epidemics, infections, they do not affect people equally. This is not the great equalizer. We know that communities like the one right here in Chelsea, Massachusetts, which I'll have a chance to volunteer at on Saturday, has a health center that is at the epicenter of the entire state's epidemic. And that community is largely immigrant. Many of them undocumented, some of them undocumented, many of them very poor. The great majority are still essential service workers, and they're the ones ensuring that the hospitals stay clean and food delivery still happen. And so it's not surprising that the infection rate and the death rate is highest there. Well, those hotspots track with inequality across this country. And so to me, I know that my fellows at Echoing Green are working precisely with those communities, whether it's on the healthcare response, groups like Care Message, which are putting out, have transitioned their messaging system to make sure that the lowest income chronically ill patients get the right messages and instruction and education on COVID, both for their health, but also for social support. Or it's groups like Girl Trek, which are working, as you all know, with Black women and girls for many, many years, committed to their health and well-being, and are dedicating, $100,000 of their funding to support their Girl Trekkers, the women who stand for healthcare, and they're going to start providing 3 to 5 grants per week to those communities, right? I mean, to me, those are examples of fellow organizations that are going where the hotspots are and paying attention not just to the healthcare issues, but the social and economic needs of those communities that are at risk. So I'm proud to be part of this, first of all, as a fellow, like Cheryl has been. I'm also grateful to be on the board of Echoing Green, where I know many of you have been collaborating with us to try to ensure that we can support these fellows at this time. Let me say one last thing before I pass it on to you, Cheryl. At a very personal level, when Echoing Green invests in not only the best social entrepreneurship talent in the world, but we are and you can just see it, one class of fellows after the other, investing in the people closest to the problem. It's the very people who look like, who have lived experience in, and have been proximal with their, not their mind alone, but their soul to these communities that are our fellows. And I happen to be one of them from Africa. Echoing Green took a bet on me. Many of you supported Echoing Green to do that in 2011. 3 years later, while we were still a startup, the Ebola epidemic hit us. We had a budget of about $1.5 million annual operating. We were one of those organizations that had no operating reserve, like Cheryl talked about. And I can tell you what was as hard for me as a CEO was not just the public health side, which I knew my organization could do something small to respond. But I didn't think I'd have to deal with the anxiety of worrying that my nonprofit would run out of money, that I would have to go out and worry about how to tell my staff whether they're going to be furloughed or stay on board or not, whether we would exist several months after. I remember a board member telling me, this might put you out of business. And I had no clue what he was talking about. I'm fortunate now that we're a little longer in 9 years out from Echoing Green Fellowship, thankful to Echoing Green for the investment they made. We're much more technically savvy in dealing with those situations. I have an HR division that can help us plan and communicate with my staff. We have some operating reserve to be able to help us. But the great majority of the fellows that Echoing Green's been focusing on investing are those last mile healths of 2011 to 2013 that simply, without the cash on hand, without emergency funding, without technical support from a group like Echoing Green, simply are going to have a much harder time getting through this exactly in the moment that they're needed. So I just want to thank Echoing Green for that leadership, and to all of you who are trying to support those early stage ventures that can make a big difference right now. Over.
No, thank you for saying that as well. And before I come back to you on some of the public health stuff, Carter, I'm curious if you have anything to add. It's interesting that obviously this is such a global, pervasive disruption. I was recently reading something from Mark Snyder, who's the chairman of the New York Angels Group, and there was some data coming out even for-profit startups that, roughly half of the members of the New York Angels Group said they plan to decrease investments in startups that aren't already in their portfolios. 5% of that group said they were going to cease investing altogether. Just be curious from a business perspective, how what does this moment look like to you from sort of an investment perspective?
Sure. Well, look, there's a couple of big trends sweeping around the world, certainly in the United States, and it's happening elsewhere. I think many of the governmental entities actually developed a reasonable playbook in 28 and 9 of how to not let the financial system seize up. So the first order matter, the United States is in the process of pumping $8 trillion of liquidity into the economic system. So they're focused on not, letting the financial market seize up and making sure capital at least is out there to be deployed. Having said that, to your point, Cheryl, everywhere I turn, be it philanthropists, venture capitalists, private equity firms, they're all kind of hunkered down, focusing on their own internal set of issues, and are reluctant to really extend themselves into new ventures. So where I sit, what it means is you have to work even harder to find those who view the world order in such a way that they have their own issues in good frame and are prepared to help deal with the world's problems. So I think there's plenty of liquidity swishing around, and probably not quite yet enough bravery to really step up and get deployed where it needs to get deployed. And I think one of the roles we can play is where we operate, and with the fellows that we have in the field, connecting some of the dots and helping people understand there are people such as Raj and many, many other fellows that are out there deployed with functioning organizations that are perfectly capable of stepping up if they have the resources to do so, to help put the world back together again.
Thank you for that, Carter. And it's interesting, there's some additional reading that I was doing about early stage angels who said another sort of rate limiting factor in this moment was it's so critical for many early investors to have sort of face-to-face capabilities to sort of feel the vibe and energy of the entrepreneur. And when we've been disrupted from being together face-to-face, it's problematic for a whole host of reasons. I will say on the philanthropic side, there has been some writing around counter-cyclical grant making. So they've looked back at the 2008 downturn and the few funders who actually didn't decrease, but really leaned in. And kudos to groups like the California Endowment, who did not retrench, who did not pull back, and did the kinds of grant making practices that I hope some of us are experiencing, where they're really focused on unrestricted funding. They're relaxing particular deliverables because everyone understands that this is all hands on deck, because we've got to do this transformational work that is required. And I love what Raj said about pandemics, that, you know, this really is a moment. There's a Yale historian, Frank Snowden, that says, you know, pandemics both reveal societies and equities, but they also open up such a moment for transformation. So it's this potential fork in the road, and it's up to social innovators like Raj and others to determine which fork to take. And I would love for Raj, again, you're such a visionary, you're such a leader in this space. And I've been rereading, Jim Kim's article where in the New Yorker sort of talking about what we have to do as a society to sort of get to the other side, not back to normal, but to the other side. Can you talk about, again, some of the lessons you learned from being on the front lines with Ebola, Raj? What's the moonshot? What's the Marshall Plan that you envision for our country?
Well, I think so far the virus has all of us on lockdown. And I think for us to succeed, we've got to put the virus on lockdown. And for the virus to go on lockdown, of course, we're all waiting and hopeful about a vaccine, which will help if we can get it equitably distributed, I should say, to the most at-risk communities. We also know the vaccine is probably at least 12 months if not longer away. So what do we do in the interim to lock the virus down? Well, there are some scientifically proven things that can be done, right? I mean, if you think about locking down the virus into a box or boxing it in, as some have said in the public health community, there are really four sides to that box. We've got to test a lot more. We've got to make sure those who test positive get the treatment, meaning even the oxygen therapy and the other antivirals that are coming on board. That the third side of the box is to make sure that those who are exposed to the virus and may be at risk of coming down with the infection are isolated, and that they're tracked or traced. Contact tracing is the other piece to see if they fall sick with the virus, and if they do, to pull them out of into making sure they're isolated or get the treatment they need. So those are the four sides of the box: to test, to trace, to isolate, and to treat. Of course, social support needs to be part of that as well. So, that's a method that's worked in other epidemics, and that won't extinguish COVID, but it can suppress the virus. We've seen this happen in other epidemics, be it as different viruses, like the Ebola epidemic. We were able to work on those four areas and box in the Ebola virus until it did eventually extinguish. How does one get there? You've got to have a health force. You've got to have a massive workforce because for a long time, our country here in the United States, like many other countries in the world, have underfunded public health. So this local health department, your city health department, does not have the staff it needs to be able to do all the testing, the tracing, the isolation, and then getting people into treatment and care. So, of course, to get that done, to build that health workforce, we're going to need to train hundreds of thousands of more people. So we know that at least 180,000, perhaps as many as 500,000 people need to be trained to do this work across the 50 states. And one of our answers may come from an unexpected place. It may actually come from our neighbors. It may come from those who've been suffered the worst of the economic blow of the pandemic. We know that many people have lost their jobs. Some of them will probably be furloughed and go back to work. Others will not be so fortunate when this epidemic starts to get more under control. So we can hire the unemployed, those very people unemployed by the pandemic, to retrain them and hire them to fight it. And this simple idea is one that many countries have used. It's called community health workers. And the idea is to take someone who doesn't have a medical or professional or public health degree, but make them part of the public health team. And so there's a coalition of nonprofits here in the United States working with many states across this country, from Friends and Partners in Health in Massachusetts to Health Begins in California, and others like the National Association of Community Health Workers. They're all trying to work together to help states figure out how to do this. And you're seeing some announcements, including in New York, of states wanting to hire thousands of people to do contact tracing as one key element of this. So we've got to have that investment, but we've also got to make sure that the local community-based organizations that are already working with community health workers like this also get some of the support they need to retrain those workers, or to support them to actually deal with the social needs in those communities. So if we can do that, then we have a better chance at accelerating the opportunity to lock down the virus and actually bring us out of lockdown and reopen the economy to some degree in a data-driven way.
So, and I'm going to
Cheryl,
yeah, please. Yes.
Could I add a couple of points to that? I think there are a couple of broader points to the points Raj was making, which is, as within the 1930s and the Great Depression that occurred then, that coming out of that resulted in a larger government getting involved in fixing the ills that they had identified. So Social Security and everything else that when Roosevelt came into office came out of that. The same thing's going to happen here. You don't spend $8 trillion without some accountability and some things changing. So I think Raj is right. I think in the healthcare world, you're going to see, and most people have noticed we have an election coming up in the fall. You're going to see a lot more focus on support for a more active healthcare policy. I think what Europe's doing with furloughing people of 80% of their wages is going to allow them to come back much more quickly than when you just displace people and have businesses start up from zero again. Well, we'll learn a lesson from that. And then, although it's far-fetched, I don't think anybody's missed the fact that the air is a lot clearer. It's a very expensive way to demonstrate the value of or the threat of climate change, and the value of being a lot more focused on that. So I think there, to your earlier point, Cheryl, a lot of systemic positive changes. If the world and countries stay on top of it, they could come out of this.
There's actually a bill that just got introduced today to try to include it in the next round of relief funding for a health force. Senators Gillibrand and Bennett have introduced it, but it's going to be a cross-partisan effort. And I would encourage people to support it. The goal is to potentially hire up to 1 million unemployed Americans to do the work of public health and hopefully add to the ranks of community health workforces across the country. And let me say, I've also been in touch with those senators' offices last Thursday, and it's great that there could be some public funding coming in, but we all know, and we've seen this during the Ebola epidemic, that one, it will take longer than we think. That bill's getting introduced today. It could take weeks or months if it even is successful to get introduced. Second, a commitment to disperse is not actual dispersed monies. And so philanthropy can move a lot quicker than, as we saw during Ebola, where a number of philanthropists actually helped alleviate the pain that the public sector eventually would get around to, at least by months, if not years, before the public sector got around to it. And importantly, that's a leverage proposition. I mean, I don't think there's a better time than now for philanthropy to shape what those big plans are going to be like. That Marshall Plan that could come after this, this bill, for instance, in the United States, if we could support some of the public health organizations, the community-based organizations, many in like the Echoing Green portfolio, to be working with the states to set up the training methodology, the private-public partnerships that are needed, so that when the public money comes in, it's spent well, because there's a big risk that it won't be, as Carter was bringing up.
You all make such great points. Professor Rebecca Henderson, she's a Harvard Business School professor, just released a new book called Reimagining Capitalism that really speaks to the power of recognizing and investing in both civil society and government. They are both absolutely necessary partners to do this work correctly at scale. And I think you both are speaking to exactly that. I want to get back to something to Carter in a second, but I want to, Raj, will you tell the group, I've read with interest many of the innovative proposals that I'm reading about. I saw Dr. Josh Sharfstein's piece in the Journal of American Medical Association calling for the 20,000 medical students in this country to defer year one, to become full-time contact tracers, to get out into the world and really be vital frontline workers of the public health care infrastructure in this country. You all have done so much in putting a lot of your community health worker pedagogy and training online. Can you talk about that? Can you talk about the Academy and how you see that as a critical component of this work moving forward, Raj?
Sure. Yeah. So we have for the last several years tried to build some online training programs because we realized that many people in the world, really any region, any corner, were realizing that community health workers were critical for both addressing healthcare needs and through employment and being more proximal to the social needs, also addressing some of those. And so we said, what if we could create something that could be a platform where other groups can learn from each other how to build similar programs. Folks wanted, so we put up one of our first courses last year that's called Strengthening Community Health Worker Programs. And it's actually being taught by colleagues from Liberia, Ethiopia, Bangladesh. So these are countries that have actually successfully over years or decades both dealt with early epidemics. Liberia started in response to the Ebola epidemic, but were able to actually hire, train, and equip local community, local residents to respond to the epidemic in the acute phase and then rebuild and reimagine healthcare afterwards. So Liberia now has a community health worker within reach of every last child and family. They're the ones who've been dealing with the malaria epidemics, the complications of childbirth, dealing with social and economic issues, and now are being engaged and retrained to deal with COVID. So Ethiopia's done the same, Bangladesh has done the same. So we started teaching this online, and to our surprise, we thought maybe this people in Africa and Asia, this would resonate with, but actually a quarter of our class are Americans who are working on, I thought, most of them are living here but working abroad. I was wrong. The great majority of them are involved in programs, in community health programs here in the United States and in all 50 states. So we now have over almost 50,000 people enrolled in these courses, and about a quarter of them come from the US. So we've been sharing those insights with this community. And I think one of the key insights is that right at the point you're getting at, Cheryl, if we do this the right way, we could deal with the contact tracing issues and the other components that are needed to box in the virus, and make sure that community-based organizations, community health workers, those like Girl Trek, like Care Message that are working with these frontline providers are actually responding now and strengthened for the long-term needs that are there. If we hire, I'm not opposed to hiring medical students. I used to be one. But if we just focus on contact tracing itself, any means to get there, that's not a bad option. It's just that we might miss the opportunity. It's very different to hire 20,000 first-year medical students who've deferred first-year medical school to contact tracing than it is to give grant funding to the Girl Treks and the Care Messages and the many other organizations across this country that could do the same work, but will hire people from the most affected communities. And when COVID's done, and boxed in, then they will still be there to ensure that healthcare can be reimagined for those communities because they're proximal organizations. Again, that's why I think so powerful about what Echoing Green's been investing in on health, on social and economic issues, because they've been investing and betting on people from those communities who look like those communities, who've had the lived experience of those communities, and importantly, have been there before, during, and after coronavirus.
That's so beautifully said. And I so appreciate your analysis about proximity and investing in talent. And I want to turn it back to you on this point, Carter, because you've done so much work over the years at your alma mater of Stanford. You worked with legions of young people in the classroom, beyond the classroom. So recognizing how do you invest in next generation talent? And I'm reminded, I remember back in the 2008 Great Recession, there was a seminal article that came out of The Atlantic written by a guy named Don Peck, who sounded the alarm, sort of talking about this new era of high joblessness. And he said it was going to impact young people's salaries, even marriageability rates, because it was such a punch to the gut that these young people were coming of age in this recession. There's an economist, Lisa Kahn, who talks about scarring and how these young people coming out into the workforce, it really stunts their earning capacity and their opportunities for upwards of a decade. And so that's sort of the glass half empty proposition, but also speaking to Raj's point that this is the work of the world to do, right? We can go and lean in, get these talented young people putting their shoulder to the wheel against this problem, against the climate threat. I'd be curious how you're thinking about sort of this generational workforce that's coming online now.
Yeah, well, it's an excellent question, and I have some thoughts, not answers, but if you go back to 2008-9, our most recent experience, what you said is absolutely correct. There were years after that where it was a real struggle, to come out of a college or graduate school environment and find employment. And to this day, the economy that certainly in the United States we've created has in many ways not been that positive an experience for people in their 20s. I would say, certainly Stanford, which I know the best, the dean has directly reached out to a bunch of alumni to say that COVID-19 has really changed the dynamic substantially, not only for graduating MBAs, but also and undergraduates, but also just people looking for summer jobs. So, we're tiny, but I think others are stepping up. The other thing I think is very powerful, and it's been going on for several years here, and I'm sure Stanford's not unique. I'm sure it's a trend we're seeing, if not globally, certainly in the United States, is in the most recent entering class of Stanford, 39% of the incoming MBAs check social entrepreneur as their first career choice coming out of the MBA program. So Stanford's now retooling their curriculum to try and make sure people going through that 2-year experience at that particular institution are more battle ready, if you will, to step into the world as evolving and really do work that makes the world a better place. So I think the sensitivity around it has been growing over the last few years. I think, the coronavirus makes it a much more real-time issue for everybody to deal with, and they're certainly scrambling as opposed to, planning ahead on it. But look, I have great hope that it'll have a positive impact.
Great. That's really helpful. And, I want to make sure that our assembled guests and friends have the opportunity to ask questions of you all. But I want to talk to you both about this question of leadership. We've seen positive examples of leadership in this moment and unflattering examples of leadership in this moment. I won't give specifics, but, it's interesting. In doing a lot of reading around the global response, there have been numerous articles that the best responses in the world to date have come from countries run by women. Angela Merkel told her fellow countrymen and women that this was going to be really tough, that most likely 70% or so of the population would be impacted. The Prime Minister of Taiwan put in place 126 measures immediately that really tamped down on the caseload and has led to such a small number of deaths. It's incredible. The Prime Minister of Norway held a press conference just for children. No adults were allowed. She wanted the children of the country to be able to talk to her and ask her questions and for her to be able to tell them that it was okay to be afraid, that they would get through this together. And I thought there was something so powerful about these examples of leadership. And Raj, I'll start with you, because so much of your example and leadership and vision was in partnership with President Sirleaf, Ellen Johnson Sirleaf. She was a vital partner to you and you to her. And I'd love to hear your thoughts on the interplay between social innovators and public leaders to solve problems like these.
Yeah, well, I think it just proves all along that women have the pathway to leadership is really through humility. And I think women that I've had the privilege of working with, like President Sirleaf, have shown how much humility they can bring, how much more secure they are with their own leadership abilities, that they can be honest and unflinchingly honest at a moment of crisis. President Sirleaf is a great example of that. She, years after this epidemic, the Ebola epidemic in Liberia, wrote for the BBC just recently an article, and the real headline on it was the mistakes that she'd made, and was using, for instance, quarantining forcibly a low-income community in a very impoverished part of the capital city of Monrovia, and that resulting in the death of somebody got shot because people resisted that, and how she learned with humility that she needed to actually move towards a more caring and social support version of and trusting, and she actually literally went into that community the very next day and apologized to them. So to me, not only it's so critical to have those voices, and I think when you find them in government, and President Sirleaf, actually I've had the privilege of working with her on this new Presidential Center for Women in Development, which is trying to help lift the next generation of African women to the highest echelons of public service. And that very week she released that BBC piece. She also brought her first 15 fellows together in Liberia. And the mayor of Freetown in Sierra Leone next door, the leading human rights lawyer in Ethiopia, they are, even at none of them are heads of state yet. They were all practicing their presidential wave when they were finishing up, because one day they will be. But in the interim, they're on the front lines of this, and they're bringing that same quality of leadership. So I think it's so vital about your point about philanthropy helping bring social enterprises, be they for-profit, nonprofit, hybrid, together with strong public sector leaders. We may have a hard time finding that at certain levels of our government here. But there is a level of government. I think that's what also is being revealed by this. You're seeing it at the state level, at the local level. There are governmental leaders that are working who are very capable. And, as in philanthropy, in the social sector, we need to find those people and join forces with them. And again, one of the great ways to do that is through the community that all of you are around with Echoing Green, because it takes having been there BC before Corona, and it takes the commitment to be there AC after Corona, that allows a government to want to engage with the social sector. It's built on relationships. So I think the more we can do in this moment to find, whether it's female leaders or others who have humility, and making sure we're bridging the partnerships between those frontline social enterprises and those entrepreneurs and those public sector leaders, I think philanthropy can make a massive difference there.
That's helpful. And Carter, I'll pose the same question to you. You occupy this really interesting and unique space where you sort of diffuse between the worlds of government and business and the social impact sector. I'm curious how you see sort of great examples of leadership, how you would hope these sectors would show up in this moment, and how we could work together.
Sure. Well, let me come back to the first part of what Raj said. I think in my long experience at this, the best leaders are people who surround themselves with great people, who set clear direction for them, kind of establish broad fences and get out of their way, and are around when they see them kind of getting near a cliff, but largely let them really achieve their fullest potential. And, I think just quite frankly, women are a little better made up to do that than men are. I think there's often less ego in it. I think they're generally more empathetic and often are better suited to that kind of behavior in terms of surrounding themselves with talent. To your broader question around government and philanthropy, and this point was made earlier, but I'd come back to it. I remember, Cheryl, when you and I attended the Rob Reich presentation in San Francisco about his book about philanthropy architecting strong solutions to problems and getting out of the way, or motivating government to really turn the fire hose of capital behind it to get it to happen. And I think that opportunity is, exponentially higher now than it was a year or two ago when you and I heard that, in terms of finding ways to get on top of the issues of this amazing displacement and economic dislocation that's occurred, and helping through philanthropy and through the people in the field that have been deployed to really help with this, get the resources that they need to really make some progress on this.
No, well said as well. No, thank you both. That's really helpful. I want to make sure that we have opportunities to have some Q&A, and so our guests can ask questions of you all. Cara, maybe you're leading the charge on that. How would you like to proceed?
Yes, so I can go ahead and jump right in. We've had a few questions come in through our Q&A. We have one from Joanne Henry that's focused on advocacy and messaging that acknowledges vulnerable communities. So Joanne asked, as we think about how to support the work of these essential frontline nonprofits, how does advocacy and messaging take into account the very real possibility that for some in leadership in the US, the devastating impacts of COVID-19 on the most vulnerable communities may not be accidental, but strategic? There was a time when advocating in a situation like this would have appealed to common sense needs of these communities. But what if those with the most resources to allocate to key nonprofits aren't thinking about or aren't prioritizing vulnerable people being financially ruined or dying?
And I will say, and I'm going to ask Raj and Carter, and I can jump in, but I have to say I am so happy to hear from Joanne Henry, who's an Echoing Green alum, a fierce and amazing social innovator who has been in the social justice game forever. She's a child welfare expert, got her start doing environmental justice legal advocacy work in Boston, and just so wonderful to hear from her. Raj, Carter, any thoughts on sort of the importance and necessity of advocacy, recognizing that these structural inequities help a lot of folks as much as they hurt many other folks?
Raj, you want to start a little more in your lane, maybe?
Sure, yeah. I mean, Joanne, thank you for your question. I mean, power's never been easily given by those who have it. It has to be demanded by those from whom it's been taken. And the truth is that a lot of these communities, power has been taken from them, many, many years. And so we have to even, one narrative around this is we need relief. Another narrative around this is we need justice. We needed it before, we need it during, and we need it after this crisis. And those have practical differences, to Joanne's point, in the way we structure this response. A relief response might be hire 50,000 contact tracers from anywhere. A justice response to this might be hire only from those communities that have been most affected by the virus, or hire only unemployed people. Work with not just the CDC, make sure the CDC, the Centers for Disease Control, if they get a large federal grant, are required to invest in local community-based organizations. I mean, to me, because it's a long-term structural issue, not one that's simply about an emergency response.
I think that's perfectly said. Carter, anything you want to add on that?
Just briefly, I think a lot of the resources to support these things now are not in the hands of the public sector, or even or the private sector, or even not-for-profits, but in the hands of the federal government, which is deploying massive amounts of money. And the levers of power there, to Raj's earlier point, are really focusing first and foremost on the bigger issues that aren't, kind of in the smaller business, smaller community aspects of it. And it will probably change a little bit of a change. Well, it will take a change in the levers of power, I think, to get a lot of momentum behind this. So I think we have to work really hard between now and when that happens to do as much as we can. And I think it will get a little more sympathetic ear once we get through the fall.
Yeah. And the only thing that I would add, and Joanne knows this as well as we do, I mean, I think number one of the reasons I was attracted to social innovation so many years ago, well, there are two reasons. One is sort of the power of narrative change as a tool for social change. And there was something so sticky and so mesmerizing about using you all as social entrepreneurs as the vehicle to tell the story about those inequities. As human beings, we learn through stories. And I just kept thinking, my gosh, the power of you all as sort of narrative leaders just continues to be so compelling, and to tell the stories of these structural inequities. And I think increasingly, I have maintained my affiliation with social innovation because I also think it is a powerful tool for building power. And I think I've come to that conclusion because I look at this ever-growing network of Echoing Green that, is a collection of these incredible individuals, but sort of collectively who are starting to have an opinion on what is not working in society, but also throwing forward really disruptive, next generation, innovative thinking is a form of power building. And so how do we shape it? How do we support it? And how does a network like Echoing Green stand in that breach and sort of be sort of that ecosystem player to help build further power that you all need, that we all need to actually sort of dispense with these structural inequities once and for all. A work in progress, but I think there's potential, especially in this moment. Next question, Cara.
Great. Yep. So we have another question from Rolf Hilberg Jr., focused on funding for-profit organizations creating products and systems. So Rolf asked, there are a lot of calls for funding for not-for-profit organizations, while actually several for-profit organizations have also some very feasible products or systems to be used against COVID-19. Why aren't there more interest to see what is being delivered, at which prices, et cetera, and not by whom?
Any thoughts? No, I think that's a really good point. I think this is going to be a really interesting moment where innovation, which has really been such a powerful tool in the business sector, will start to reimagine what society looks like moving forward, and opportunities will abound on how do we continue to do more remotely. How do we think about education fundamentally differently? And education technology could continue to grow and explode. In the healthcare sector, Raj, I can only imagine the opportunities that will be fueled to make sure our public health infrastructure, which is chronically underfunded, it leapfrogs forward to keep more of us safe at a lower cost. So I think we're going to have to pivot in terms of these investment opportunities. But I think it's only a matter of time before capital, which is always looking for a home, and assets are always looking to be placed, that there will be real opportunity moving forward. I'm curious what you two think about that.
Well, I would just say, if I Cara, understood the question correctly, and the for-profit aspect that was embedded in the question, I mean, Cheryl, half of our applications are for-profit business models. So there are people coming up with social impact solutions in many of the areas that we work in that happen to have a double bottom line model where there's a for-profit element to it and also a social impact element to it. And certainly there are a lot of big institutions in this country like TPG and Bain and others who've set up entire funds around looking for social solutions, social impact entities and companies that also have a for-profit model to them. So I think it'll come in both flavors, if you will, in terms of how the world responds.
Yeah, I don't have, I mean, you both said it. I don't really have anything to add. I was going to say something very similar to what Carter said.
Yeah, and I would say the last thing is for Rolf, I think I heard the questioner's name correctly. You're starting to see calls for prizes and challenges on how we're going to innovate our way out of this. I now sort of have bookmarked, the Milken Institute has a new website dedicated to many of a lot of the work being done on the continent of Africa in this moment. How are funds being deployed? How are we thinking about infrastructure on the continent? And I just, within the last 2 weeks, saw a challenge for new business ideas around this moment to serve and protect and invest in populations on the continent. So I actually do think we will see an uptick in these sorts of opportunity to spur innovative thinking. I also saw something recently from the early stage investor Y Combinator, who had developed a fund specifically for COVID-19 responses. So I do think it will continue to tick up over time.
Great. I think we have time for one question quickly. This one is from Bruce Bachman, who asked, if you had to structure a 3-hour learning session to supplement what a social entrepreneur would have learned in business school to better enable the student to enter the business world in today's COVID environment, what would be the major elements in that session?
This is a Cheryl question.
No, I'm curious. I'm looking at Carter on the screen because you teach a class every year at Stanford Business School. I have my thoughts, but I will let you and Raj go first, and I'll play cleanup.
Raj, do you want me to start, or Raj, want me to start, or do you want to start?
Why don't you start, Professor McClelland?
Okay, look, I would just say that, how would I answer that? I would say, per my earlier comment about how I think institutions, higher education institutions in this country are responding to the desire of people entering those institutions to be more socially responsible and to define a life's work around ability to create a better world. And as I mentioned earlier, Stanford is the one I know best, really focusing on changing the curriculum. I think Bruce's question around a 3-hour learning session, I think I would just heavily infuse with what are the real learnings from how rapidly things can change when things like pandemics come along, and what kind of stresses and strains does that put on the system? And how do you as an operator in that world be alert to and rapid to respond to those stresses and strains as they emerge?
Yeah, I would add to that just and reinforce it that I think 2 things. One, just staying disciplined in a crisis, I think is a really challenging thing to do. Focusing by fighting, right? Fighting by focusing. I think that's really critical. How do you stay both adherent to your core competencies and also leverage those core competencies and not get distracted or not assume you can do something without humility. And then I think the second thing is long-term investments. I think to me, a lot of the recent thinking in the business sector and the social sector has been short-term focused. We kind of look and are hungry and are impatient, understandably, for impact or profit or whatever it is within years. We should really be thinking about it over decades. And I think teaching our upcoming social entrepreneurs, even ones like myself now, what does it mean to commit over decades to something will help us weather a storm like this.
Yeah, the only thing I will add, it's nice. Thank you so much for joining, Bruce. It's been far too long. In many ways, it's the perfect question because, in fact, Raj and I just completed a year as visiting social innovators at the Harvard Kennedy School. Raj was joined by his colleague, Leisha McCormick, the COO of Last Mile Health, and we spent a year working with the team at the Social Innovation and Change Initiative. They're really focused on the pedagogy around social impact and change. We also work with the Harvard Kennedy School on an initiative that we started with 5 historically Black colleges and universities working with extraordinary students who were interested in social change. So a part of the pedagogy was first the recognition that there are multiple paths to social change. I often fear that all of these young people want to become social innovators. Most of them should not be, but they should all be involved in social impact. So having a clear understanding of the multiple pathways to drive impact. And then there's sort of a distinction between how do you initiate these efforts, but it's sort of the, it's 1%, innovation, 99% perspiration. Like, how do you actually implement these initiatives? So sort of the tactical, practical skills around implementation that I think are really critical to many of these young next-gen thinkers who are so committed, but need to think about both the idea, but then the execution on the idea. And those, I just would add that to what Carter and Raj already shared. Well, we are 2 minutes over. I know we could go on forever because we've had these 2 extraordinary thinkers and leaders, and I can't thank Carter and Raj enough for leading us through this conversation. I can't thank each of you who joined this call. If anyone is interested in the Fund to Mobilize Against COVID-19, please reach out and follow up with us. We believe this is a journey. We believe that sort of the work in the moment around emergency and recovery is just the beginning. It's the transformative and transformational conversation that we think will really be most impactful for many of the disproportionately impacted communities our fellows serve. That is the real nub of this work, and we'd love to partner and collaborate with as many folks who are interested, because that's the work to do. And in tough moments like these, we recognize that it's only through partnership and collaboration that we will succeed. So we're most grateful to our speakers and most grateful to all of you for joining us today. Carter and Raj, any last minute comments before we sign off?
No, Cheryl, I think you said it well.
Yeah, no, just thank you for your commitment. I just think that it's so important right now. I don't know if most people know, I didn't until I joined the Echoing Green board, that we actually are raising our money every year to support these fellows. So it's extraordinary that the staff would go above and beyond, as with the board, to try to help fellows in this moment. So I just want to thank all of you for partnering with us in that effort.
Thank you. And we'll be in touch with everyone. And thank you for your time and attention. And Carter and Raj, thank you for such a productive and interesting conversation. It really means a lot. Okay, everybody.
You're welcome. Our pleasure. All right.
Take care. It was terrific.
Bye-bye.
Bye-bye.
Bye.